It is 9:36 as we switch gears and go to health and COVID-19. And Dr. Kevin Kavanagh, he is a retired physician from Somerset, Kentucky, founder of an international organization called Health Watch. I guess it's just a national organization because it's Health Watch USA. Unless we want to change the name to Health Watch International, what do you think, Doc?
Well, that gave me an idea. Really, if we just get one person from outside the United States to join, we can then say we're an international organization.
Heck yeah.
Yeah, that's pretty good. It's kind of like being an international airport. One plane lands from Canada once a week. You're an international airport.
I got a cousin in Mexico. I'll fix you up before we leave today.
That sounds good.
Hey, let's talk about this for just a second in all seriousness. And I don't think you'll mind me mentioning this, as you recently had somewhat of a health scare and had it checked out, and it turns out it's going to be fine. But your point in wanting to talk about that was because of the COVID-19, people may not be tending to their own health as they should.
Well, that's correct. And that's one of the big worries. And I kind of refer to that as collateral damage. It's the virus doesn't directly result in a fatality or in disability, but scaring off people not getting health care, that does. And that's not a good thing. I can tell you right now that at least in Lexington, the healthcare facilities, the healthcare personnel, the doctor's offices, they're safer to go into than many of the stores in Somerset, Kentucky. Not that the stores in Somerset, Kentucky are doing a bad job, but they're not testing all patients that come in for COVID prior to them coming in. That was the case at the surgery center. Everybody was wearing masks. Everybody was social distancing. So, unless you're going to stay in your house all the time, or when you go outside, be at least 60 feet away from people, going and getting health care is a safer type of an activity to do than what you normally do when you interact with people in the community. So please don't stop going to see your doctor. And as you know, Jack, I had a skin cancer removed earlier this year during the COVID epidemic. I also had another health scare. I had to get a biopsy at a surgery center. So all of this are really major types of medical problems that if you didn't get them taken care of could have resulted in long-term problems for me. So you shouldn't be scared of this virus to the point that it's affecting your health and having you make poor decisions. You need to weigh the risks, and believe me, keeping yourself healthy is an extremely huge benefit that you want to make sure that you're doing.
Absolutely. All right, couple things. This probably isn't the most important of the two, but it may be getting more press than anything else, and that is Dr. Anthony Fauci suggesting that people, and somebody corrected me earlier this morning, and I guess it's right, this piece right here that I'm reading from says that people should wear goggles and face shields to get added protection against coronavirus. He actually didn't say you should. He said it's something that you might consider, or it wasn't as direct as you should do it. But with tons of people out there that are not even crazy about wearing a mask, I'm not sure that statement did his cause much good. What do you think?
Well, yes, it gets into the public acceptance type of a problem. But as you know, early on, Jack, when we talked about the utility of masks and whether or not they'll keep you perfectly safe, for example, will an N95 mask keep you perfectly safe? I've said early on that unless you're in a hazmat suit with goggles, you're not going to be as safe as what a healthcare worker is seeing a patient.
Yeah, that's true.
And so we've talked about goggles before. Do I personally wear goggles? No. I'm a little reluctant sometimes to wear a mask if you go into an area where people aren't wearing masks and they're looking at you funny and you're worried about kind of being ridiculed, etc. If you were to wear goggles, maybe that would be even greater. And of course, I've got on fairly big glasses, and those do help also. But if you take a look at pictures from the Far East and what those citizens are doing, a large number of them are wearing goggles. I mean, they know how to protect yourself to the hilt, and that's wearing goggles. And that's also why I kind of cringe when people say, well, I've got a mask on, so I don't need to be 6 feet away from somebody. Or my kids at school, they're going to be 6 feet away from each other with their desks so they don't have to wear masks. Probably not. Masks are a good precaution. Social distancing is a good precaution. You add the two, it's even better. But nothing is going to be 100%.
This is Jim. Good morning, Jim. You're on with Dr. Kavanagh.
Good morning, guys. And I read this, now whether it's true or not, but you never know. And I'll hang up and listen, Dr. Kavanagh. What if there's never a vaccine? Thank you.
Well, I really do think that that is a possibility that's preparing for the worst, but hoping for the best. There are a lot of stumbling blocks which can happen. You don't know how long the immunity will last with the vaccine. And so that is a possibility. And that's why we need to start doing things correctly. And one of the things that really gets me is this idea or mindset that we just need to wait this out. We need to get a lifeline to this business or to that business to hold them over till this virus goes away. And that is the wrong type of mindset. We need to figure out how to live with this virus. And a lot of that means infrastructural changes. When you talk about schools, you're talking about more classrooms, bigger classrooms, more ventilation flow to dilute the virus, having your central air being sterilized with maybe UV lighting. All that costs money. Restaurants, they're closing down. But maybe while they're closed, they should get state grants to set up for outside seating areas or to put in heaters outside so that you can extend your outside seating during the cold period of time. There's a lot of infrastructural changes which could be invested in, could stimulate the economy and allow us to safely live with this virus. But to ignore it, either by saying we're going to do nothing and extend a lifeline and hope it goes away, or to say we're just going to reopen and pretend that it's not here, either of those two alternatives aren't good. We need to set up to manufacture PPE at a very large quantity. We need to get infrastructural changes, and we need to figure out how we can live with this virus and live differently. And of course, we also need at the same time to drive this virus down to a much lower level so our chances of catching it in the community are not as great as what they are right now.
We're back with Dr. Kevin Kavanagh. This morning, Dr. Kavanagh, we saw an article online, and you know it's true if it was online, that people in the United States are storming New Zealand asking for how one might become a resident with intentions of moving there and becoming a resident because they have zero coronavirus cases there because they did such a great job getting rid of it. Now, do you know if that's true? And if so, what the heck did New Zealand know that we don't know?
Well, I don't know if it's true or not, but I have to admit, Jack, I've kind of thought of the same thing myself and can't figure out how to get down there because people don't let you leave the U.S., unfortunately, or you can leave, but they don't let you to enter anywhere else. But what they did is they locked down the country. Of course, it's an island. You can do that. And they followed good public health advice. Everybody in the country bought into snuffing out the virus, which is a long ways away from where we're at, where some people still think this is nothing worse than a common cold or the flu, which, of course, the flu is very dangerous. And this virus affects every organ of the body, so it's not the flu. But definitely New Zealand has done it right.
Okay. Here is a text from Todd, and here's what he says. Jack, we can't fight nature. This virus is going to do what it's going to do. If we can't cure the common cold, which is a coronavirus, how the heck can we have the gall to think we're going to cure this? What do you say to Todd?
Well, we definitely can fight nature. Medicine's proven that over the centuries. We've been able to stay one leg ahead of it. And although we haven't been able to cure the common cold, this is a different type of coronavirus, and it's one which we have over 100 companies focusing on how to cure it. And so that is really a big edge up on what we were like maybe 20 centuries ago. So we are out of the cave age. We're into modern science. We have a lot of tools available, And I'm not going to discount science. I think they're going to come up with either a cure or a way to severely mitigate this virus so that it's not as dangerous and that we can get back to a more normal life. That is what I believe is going to happen.
Okay. Do you want to talk about hydroxychloroquine and that information that you sent me, or is it too late to get into that?
No, I think we can talk about it. And I think it's very important. There was a recent study out of Brazil, which was a randomized controlled trial, which showed hydroxychloroquine did not work. Brazil is a country that the United States donated some 2 million doses to, and that was published in the New England Journal of Medicine. But more importantly, there was another article published in Nature, and this was a mechanistic type of an article looking at how hydroxychloroquine inhibits the coronavirus. Because as you know, many years ago, there was a laboratory article which showed that in the laboratory, it inhibited the virus from entering cells, and therefore hydroxychloroquine might work in people. Well, what this article found out is that the virus, when it enters the cell, it needs an enzyme that's produced by the cell to aid in its entry. And the virus depends upon either the one enzyme or the other enzyme. And enzyme B, for which the virus uses in animals and in, for example, monkey kidney cells, hydroxychloroquine inhibits that enzyme. But unfortunately, in human lung cells, it uses enzyme A, and hydroxychloroquine is not active against that enzyme, and it doesn't inhibit viral entry. So that this week in Nature, they now have the mechanistics worked out on why hydroxychloroquine works on some animals, but it doesn't work on human lung cells. And that kind of reminds me of the old cartoon, and this is kind of a scientific cartoon where there's a lizard standing there eating its tail, and it's saying to the rat, "Oh, go ahead and do it. It grows back. Mine does all the time." You just can't always apply what happens in the lab in an animal to what happens in the humans. And so this is a good example.
Here's another text that said, did you already talk about the Ohio Board of Pharmacy reversing its stance on the hydroxychloroquine? Is that true? Do you know?
From what I understand, there is at least some discussion of that. I haven't seen the latest. And if they do, I think it will be a major mistake. We now have 4 prospective randomized controlled trials that this does not work. Even one out of Brazil. We have the mechanisms worked out on why it doesn't work. And really, there are a lot better alternatives for people to be doing. And the 2 dangers of taking hydroxychloroquine are, 1, it'll make you feel safe, and you might go up to someone that has COVID-19 when maybe you should have been staying away, far away, and wearing a mask. And 2, there are individuals that need to take this. For example, if you have lupus or rheumatoid arthritis. And some of these individuals, where it does benefit them, they're not able to locate the drug.
Here's a text before we have to get out of here that says, I've heard that New Zealand is very picky about who they let into the country, so it would not be easy to just move there and stay. They want to know exactly how long you're going to be there and what your intentions are, what you're going to do. Make sure that you're gone when it's time for you to be gone. So that must have played into that too. We've got just about a minute left. I'll give it to you.
Well, just want to encourage people on staying safe, following the governor's guidance. I think that now most public health officials and leaders feel that wearing masks is our best bullet against this pandemic and that we should be wearing that. Please socially distance. And if you're wearing a mask, if you social distance at the same time, that's going to keep you the safest.
Have a great weekend, and we will talk to you on Monday.
Thank you, sir.